We would not think to incarcerate a diabetic or someone with MS or cancer. So why do we feel it is appropriate to send someone who has the disease of addiction to jail? I understand that many feel that those with this disease may have brought it on themselves by their choices. But many people who have chronic diseases have them because of poor choices. Eating habits, smoking, lack of exercise, all contribute to chronic disease. I believe we should be treating substance addiction the same way we treat other chronic diseases and getting treatment to those who need it, not incarcerating them. I grew up with an alcoholic. I made a conscious decision to not become an addict because research has shown you can have a predisposition to addiction if that is in your family history. In the 2001 Current Psychiatry Report, Doctors Enoch and Goldman stated, children of addicts are more than 8 times more likely to become addicts themselves. This is an overwhelming statistic and is further evidence that addiction is a hereditary disorder. I will be using the words disorder and disease interchangeably in my talk. Just know that both are correct descriptions. Removing the stigma, getting help to those who need it, ensuring education and providing behavior modification treatments are what is going to change the landscape of this disorder. Since the 80s, presidents of the United States, including Reagan, Bush, and Clinton, have declared a war on drugs, thinking that was going to curb this disease. They have enforced harsher penalties on drug offenses, hoping to stop the epidemic the drug addiction had become. However, in 2015, according to the International Journal of Offender Therapy and Comparative Criminology, harsher penalties have not stopped this epidemic. It has only exacerbated it, and that is seen by the recidivism of those who were jailed while addicted. The prison system treats patients as inmates, and they are not interested in their overall health, just getting them off the substance of choice. Although in prison they are providing alternative treatments, such as methadone therapy, this is only treating the symptom and not treating the disease. Their focus is getting the inmate sober, not the patient treatment. It's important to not only give treatment, but the right treatment. Behavior modification and 12-step programs are the most important therapy to getting them to stop using and remain sober long term. This is not protocol for addicts who are incarcerated. One of the first things we need to do in changing addiction is the stigma that is associated with the disease. The stigma only fuels the inadequate feelings already causing the dependence. Stigma is defined as a set of negative beliefs that a group or society holds about a topic or group of people. According to the World Health Organization, stigma is the major cause of discrimination and exclusion, and it contributes to the abuse of human rights. When a person experiences stigma, they are seen as less than because of their real or perceived health status. Stigma is rarely based on facts, but rather on assumptions, preconceptions, and generalizations. Therefore, its negative impact can be prevented or lessened through education. Stigma results in prejudice, avoidance, rejection, and discrimination against people who have a socially undesirable trait or engage in culturally marginalized behaviors, such as drug use. Each one of us has the power to change how we think about this disease. We are seeing some turn in how the disorder is perceived, especially in the political arena. In 2011, UN Secretary General Ban Ki-moon said, drug-dependent people shouldn't be treated with discrimination. They should be treated by medical experts and counselors. Drug addiction is a disease, not a crime. In 2010, the Center for Disease Control published a paper with staggering statistics, including how the United States is only 5% of the world's population, but 25% of the world's inmates are in the US system. In 2016, it was reported that 46.6% of the prison population have a substance abuse issue. This is not a system that is interested in getting inmates sober. It's a system that is adding to the problem. The legal community isn't working towards getting treatment for addicts. They are only interested in bolstering their win-lose stats for prosecution. Prisons are overrun with addicts. But given the opportunity to get the right treatment, they can become contributing members of society. Studies have shown that getting behavioral-based treatments have proven to be the best and most effective when provided early and continuously to those who are incarcerated. We must do a better job of getting treatment for those that have a substance abuse addiction instead of incarcerating them. If they don't get treatment, they most likely will wind up back in jail and will not be able to break the cycle of abuse and crime. Only 1/3 of those incarcerated who have a substance abuse problem are even offered treatment. Teenagers and young adults are the ones who are most at risk, but it is proven that with treatment, they are also most likely to be successful long-term. Offenders who complete prison-based treatment and continue with treatment in the community have the best outcomes. Treatment in prison can begin as a process of therapeutic change, resulting in reduced drug use and criminal behavior after incarceration, especially treatment that provides specific cognitive skills training to help individuals recognize errors in judgment that lead to drug abuse and criminal behavior. I am not suggesting that those who are breaking the law shouldn't be held accountable for their actions, but I am suggesting that if we get them the right treatment, we can break the cycle of repeated prison terms for those who have the disease of addiction. So, if we can change the way we think about this disorder, get treatment to those who need it, provide education to those who have the power to make changes in the system, then we can make a difference in how the disease is perceived and the outcomes that can come about. Our legal and medical communities need to work together to eradicate this disease. Treatment is the answer, not punishment. In the end, this is a win-win for all involved. We have to change the way we think about the disease of addiction. We should be seeing it as a public health issue, not as a criminal one.